Good morning. I'm Alfred Allen Ibranafe. I'm a surgeon, obviously. My friends call me Allen, and I want my patients to call me just Allen. Today, please allow me to share with you the good news of minimal invasive surgery and the work that we've done here at the Cardinal Santos Medical Center. You may be wondering, out of all the professions in the world, why did I have to choose to be a surgeon and why go into the field of minimal invasive surgery? Well, being a surgeon lets you operate on people and sometimes you even save their lives. That bond is quite unique between the patient and the surgeon, as the patient puts his trust, his life actually, on the surgeon's hand and allow him to do something life-altering. Doing it minimally invasively gives the satisfaction not only to yourself, but much so for your patient, as what Jaideep have said earlier in his lecture. All the advantages is for the patient. The advantages it gives to your patient is quite immeasurable. After graduating from my residency training at the Jose R. Reyes Memorial Medical Center a few years back, still thirsty for knowledge, I went out to further my studies and skills in New York, in Mount Sinai, several centers in Asia, like Hong Kong, Japan, Singapore, or even Korea. And in Europe, coming back and seeing the need for centers to advance the need to advance the skills for Filipino surgeons, as we don't have any training centers in the Philippines back then. I joined with the Cardinal Santos Medical Center and helped build the Philippine Center for Advanced Surgery with the aim of the training center that would help bridge that gap and help fill the need for surgical education, not only to the general surgery, but to all the cutting specialties as well in the Philippines. To my mind, it would enable the Filipino surgeon to be trained here locally by world-class Filipino surgeons. And of course, with the help of a lot of world-class surgeons from Asia like Jaideep and a lot of our friends in the area. The Philippine Center for Advanced Surgery Training Center of the Cardinal Santos Medical Center is the first of its kind in the Philippines. And to my mind, it's still the only center in the Philippines that quite offer such training. It was established to provide access to world-class training while promoting the benefits of minimal invasive surgery, not only to our junior consultants, but to senior consultants, nurses in the Philippines, and to the Asia Pacific as well. Through this advocacy, the hospital's advocacy and my advocacy, our ultimate goal is actually to elevate the standard of healthcare, especially for the Filipino people, for the Filipino patient. Knowing that we have more than 7,000 islands and a population numbering more than 100 million, training our young surgeons and nurses from all over the country would allow our institution to do its part and our share in providing access to quality and innovative healthcare service to many Filipinos. Ultimately, filling up our share for our own social responsibility to nation building. In the next 15 minutes, please allow me to share with you my passion for MIS in ways that can help demystify this innovative medical service so that in the event that you or your loved ones are faced with the need to undergo surgery, you are then empowered with the right information and options which you can explore with your physician. We believe in educating the patient and educating you. Here are the 10 things that you should know about minimally invasive surgery. Number one, everybody's asking, what is minimally invasive surgery? Minimally invasive surgery, as what Jaideep have said earlier in his lecture, minimally invasive surgery, or MIS, is synonymous with laparoscopic surgery. It's sometimes called keyhole surgery because of the use of only very small incisions or maliliit na butas para lamang sa yung makapasok lang yung maliit na tubo. It's a small incision where your laparoscope or the telescope can go inside and look inside your body. Sometimes patients call it laser surgery, which is actually a misnomer because we're not using lasers anymore for surgeries. The term laparoscopic surgery came from the use of laparoscope. It's a rigid video camera scope attached to a light source and a video processing unit at the end, which gives the surgeon a direct view inside the patient. This allows the surgeon to diagnose and treat the disease using fine specialized instruments and of course with skillful maneuvering. Second question is, how is it different from conventional open surgery? Well, the good thing is that in laparoscopic surgery, there are more advantages that would usually benefit the patient. For the same kind of operation, for example, let's say cholecystectomy or the removal of the gallbladder, which is quite common nowadays, instead of a large skin incision to open up the abdomen, laparoscopic surgery uses small skin incisions, only about 5 to 10 millimeters, so quite small, 1 centimeter. And since the same operation is done with minimal damage to the body, there's a shorter hospital stay for patients. And hence, patients can go back to their normal work, return to work, and normal activities for the patient. And also, significantly, less pain after the surgery. Is it painful? Laparoscopic surgery offers the patient the benefit of lesser pain than open or conventional open surgery. For example, in open surgery, you need a big incision. While in laparoscopic surgery, you can do away with either 3 or 4 ports, or even single port, or what we call single incision laparoscopic surgery, which we do in Cardinal Santos Medical Center. And because of the less tissue damage, naturally, there's markedly lessening pain as you go from bigger incisions before to smaller holes or even just one hole nowadays. Prior to this, before when we were training, they would say big surgeons, big incisions. But nowadays, big surgeons do small incisions. How long does the patient have to stay in the hospital? And how soon can they go back to work? Well, definitely, one of the benefits of minimal invasive surgery over conventional open surgery is a shorter hospital stay. Depending on the type of laparoscopic surgery that was done on them, your stay can be as short as just 1 day or few days. In fact, most of our patients who would undergo laparoscopic cholecystectomy or even laparoscopic hernia repair, on that same day, patients are standing and walking and are ready to go home just the next day. So patients would go back to their own normal ways right after the surgery when you go on minimal invasive surgery course. After being discharged from the hospital, how soon can a patient recover and get back normal life after laparoscopic surgery? Well, a lot of studies right now would show us that laparoscopic surgery have shown a significantly earlier return to work for patients because of the use of fine instruments and careful movements. There's less tissue manipulation, and the internal organs are able to return to normal function much faster than the normal or the open surgery. However, because this is still surgery, the body still needs a few days to heal from physiologic stress. So depending on the type of surgery done, full recovery can take at least about 24 hours to a few days to a week, depending on what surgery the patient has been done on her. Is it more expensive than open surgery? Well, laparoscopic surgery is a little bit more expensive initially. If you look on the expenses that the patient would incur for open surgery and laparoscopic surgery, because of the additional charges for the use of the laparoscopic tower, the laparoscopic instruments, and especially if you're doing colon surgery, you add more. You have to use staplers, and for other advanced procedures that would require other instruments like your advanced energy devices. But if you take into account the other benefits of laparoscopic surgery, including the earlier return to work of your patient compared to conventional surgery, where recuperation can take sometimes up to a few weeks to a month, the loss of income for laparoscopic surgery is less, especially for patients who have an active lifestyle to maintain. So initially, it's quite a little bit expensive, but in the long run, it comes out cheaper. Is it safe to do laparoscopic surgery during the COVID pandemic? I've seen a question earlier at the question and answer box that states, because we still have the pandemic, we're trying to encourage our patients to come in earlier. We'll answer it later. But with this one, initially, the surgical community stopped doing a lot of elective surgeries because of the fear of viral transmission through the surgical smoke, which we call plumes. And of course, the aerosolized particles inside the abdomen during laparoscopic surgery. However, even up to now, to date, no evidence has shown that this increased rate of viral transmission. Furthermore, evidences from similar viruses like SARS, MERS-CoV have not shown disease transmission from laparoscopic surgery during previous viral epidemics. In fact, right now we are still working on a confined space. Laparoscopic surgery is operating on a confined space. And the surgical plume or smoke that's produced by your surgery and the aerosolized particles actually are easier to contain as compared to open surgery, where the open abdominal contents are exposed. Now, with the use of a lot of mitigating measures like the mandatory RT-PCR, swab testing prior to surgery, the use of smoke evacuators, doing surgery in a negative pressure operating rooms, which our hospital has, and the wearing of appropriate PPEs, not only for doctors, for nurses, but the whole hospital staff. We can further reduce the risk of presumed viral contamination. Short to say, Cardinal Santos, you're safe here. What procedures can be done laparoscopically? Well, the most common operations done these days via laparoscopic surgery would include, the most common would be laparoscopic cholecystectomy for benign gallbladder diseases, yung bato sa abdo. Patients would come in because of abdominal pain, and more often than not, it's because of gallbladder stones. Appendectomy for appendicitis. Patients would come in, coming out with small incisions, but nowadays with small holes. TAPP for inguinal hernia. TAPP stands for transabdominal peritoneal approach for inguinal hernias. And other more advanced procedures that can be done laparoscopically, like your thyroid surgery. Rather than having a huge incision at the neck, we now do our incisions inside the mouth and taking it out. Cosmetically better. Reflux surgery, upper gastrointestinal surgeries, colon surgeries, even for cancer surgeries, we do it laparoscopically. So basically, a lot of procedures that can be done in the open can now be done laparoscopically. You just need to ask your surgeon, ask your doctor about your minimally invasive options. The question of, can all surgeons do it laparoscopically? Well, sadly, the answer is no. You have to find a surgeon who does laparoscopic surgery. Majority of the surgeons right now, at least the general surgeons, can do laparoscopic cholecystectomy safely. And that much is what we're quite happy about. But then again, for advanced surgeries like colon surgeries, even for cancer surgeries, the success, we have to remember, of each procedure really depends on the skills, the experience of the surgeon, the right equipment that the hospital has. For other special or even advanced procedures, it requires a lot of skill and experience from the surgeon. So please, it's your right. You can ask your surgeon about it. Ask for your options. If you come to Cardinal Santos, we assure you of the highest quality and technical proficiency in minimally invasive surgery. We have the whole team, the whole department of surgery to answer for that. To answer for, is robotic surgery better than laparoscopic surgery? Well, as Jaideep have shown you earlier, there's a lot of advantages for robotics right now. The latest innovation in minimally invasive surgery is the use of robotics. And I personally believe the future of general surgery, or even surgery for that matter, is in minimally invasive surgery, may it be laparoscopic or the robotic approach. I believe that with the incorporation of artificial intelligence in robotics would actually greatly help the surgeon in curing our patients. But right now, sadly, the claimed advantages of robotic surgery, like ergonomics, for a surgeon or for the user. And despite this, however, there's no compelling evidence that would show robotic surgery is better than laparoscopic surgery. But the advantages of both laparoscopic and robotic still better than open surgery. So in terms of patient outcome and safety of surgery, there is an advantage, but there's no difference between the two for laparoscopic surgery and robotics. However, this is much of what we can say. The cost of robotic surgery is quite significantly more expensive in terms of if we compare it with laparoscopic surgery. In the Philippines alone, patients need to shell out at least $10,000 or 500,000 pesos on top of everything when you do it laparoscopically. But even having said so, I believe in the next future, in the next few years, once everything, all the expenses and all the incurred expenses doing robotic surgery would go down, I think the future is quite bright for robotic surgery and for minimally invasive surgery. Is laparoscopic surgery covered by our health insurance? I think it's one of the most common concerns of our patient. We have to remember laparoscopic surgery is still considered a surgery, and hence a lot of our health insurance can be used for these procedures nowadays. It's your right. You need to inquire with your health insurance company about your company's surgical benefits, and also depending on which program you have enrolled in. Well, with this, it is our hope that through this simple gathering and through this simple webicon, we are able to share with you useful information for you and your family's health needs. So please ask your doctor, ask your surgeon about this innovative approach to surgery. In summary, let me say that we believe in Cardinal Santos that laparoscopic surgery is the best option for your surgical operative needs. Just remember, less pain, less hospital stay, less loss of income, better cosmesis. We believe that laparoscopic surgery is the future of surgical healthcare. And with MIS, less is definitely better. Maraming salamat po at magandang umaga.
My name is Dr. Steve Costello, as noted. I'm delighted today, actually, to be given the opportunity to share my Cardinal Santos MIS surgical experience with you all. Just a quick profile on me. I do have degrees in biochemistry and material sciences, and I have a doctorate in dental surgery. I've spent my entire professional career in the study and execution of excellence while operating a top dental aesthetic clinic in Hong Kong for over 25 years. I've also spent the past decade as an entrepreneur, and in 2008 became committed to developing the world's most delicious and nutritious gourmet pili nut, which brought me to Subic Bay, where I built the world's first production center of its kind in 2015, and I remain here today. I've been blessed, in fact, with a now 18-year-old son who brings me to today's topic. Along the path to his growing up, I spent many hundreds of hours playing football with Sam after school. Of course, as you can see, I'm not 18 years old, and after some time, I began to notice, to my horror, a development of a large herniated bulge on my left side. As a very busy guy, of course, I chose to live with this for some years before I finally sought treatment. Not surprisingly, it got worse to the point where I could finally no longer exercise, and in 2017, I was inspired to seek treatment. I was directed by friends, my Filipino friends, to a popular medical center in Makati, where I received conventional or open surgery, and I had it done fairly after my consultation. but I can say that my overall experience was okay, but it was not exceptional. It was a massive disappointment, however, when by 2 weeks after the surgery, I realized that the surgery had failed and the bulge was fast returning. And in fact, as all of us, when we commit time, stress, discomfort, and money on a procedure such as this, it is hugely disappointing when it doesn't work out. So I returned to the surgeon. She was kind, and I asked her honestly to help me find the best surgeon she knew of to help me. She was very apologetic, but relieved to refer me to Dr. Alan Buenafa here at Cardinal Santos as the most highly regarded surgeon for this type of procedure in all the Philippines. I scheduled a date to meet Dr. Buenafa and discovered he was practicing a very streamlined, modern approach of laparoscopic surgery, referred to as MIS, at the hospital here. When we met, I was immediately relieved to see his confidence and professionalism, his total commitment to excellence, which is my greatest belief in life. He explained to me all the many benefits of MIS over conventional surgery, which you all know now. And of course, I couldn't wait to get started. I did meet Ms. Cherry and his team, and I have to say that the Cardinal Santos team is absolutely amazing. I've been in medicine, dentistry, and health sciences my whole life, and really, it is a tribute to you people that this amazing team has gathered together. And Dr. B is so deeply respected by his team, I just relaxed and completely left myself to his care. The surgery itself, of course, went flawlessly, and Dr. Allen even found a second hernia, which he treated on the spot. I was treated like a prince with respect and dignity, and I was always listened to. And this, for me as a patient, is such a key condition when you turn your body over to someone else for safekeeping. I must admit, I was not totally convinced when Dr. B told me I could get back to my previous good health and lifestyle almost immediately, but healing was smooth as silk, and I quickly returned to a life that I had not enjoyed honestly in years. My work, my play, my self-confidence returned, and it was easy to be happy again. It's now been over 3 years since the surgery, and I feel awesome to this day. I do a lot of yoga, walking, running, and it's incredible. My body is back. I even returned to Dr. B a year ago and had him remove a suspicious mole on my back, and he made the procedure look easy peasy. What's the takeaway? We all know that health is wealth. One of the most important things I want to share with you today is this. I took far too long to decide to get this procedure done. And as a result, I lived with discomfort and pain for no good reason. I would advise anyone trying to make the decision to proceed with MIS surgery here to just do it. Don't be angry with yourself later for risking further complications by delaying your treatment.